Being told by your doctor that you have type 2 diabetes can bring up feelings of shock, confusion, anger, and guilt about how you got it. Understanding why diabetes occurs can help you look after yourself, lead a normal life, as well as lead to possible remission of the disease. All the cells in your body require glucose to function normally. Unlike type 1 diabetes, where the body stops producing insulin, in type 2 diabetes there is insulin resistance. Cells don't recognize the insulin. To move glucose from the bloodstream into your cells, you need insulin, a hormone produced in the pancreas. 90% of diabetics have type 2 diabetes. Unlike type 1 diabetes, where your body produces antibodies to erroneously destroy pancreas cells and the body's ability to produce insulin, in type 2 diabetes there is insulin resistance. Cells don't recognize insulin. This can happen because fat around the waist interferes with insulin signaling. Over time, the pancreas has to compensate by producing more and more insulin, which further increases insulin resistance. Over time, the pancreas can't keep up, and sugar is unable to move into cells and instead increases in the bloodstream, causing diabetes. Over time, an exhausted pancreas produces less insulin. Generally, type 2 diabetes is more common if you have a family member, like a parent or sibling, with the disease. Asians, African, and Hispanics are at increased risk. If you eat an unhealthy diet high in calories with refined carbohydrates and do little exercise or have poor sleep, you are more likely to get it. Diabetes can be diagnosed by a simple blood test. Because this process occurs over a long time, you may have shown evidence of this in blood markers many years before. Prediabetes occurs when you have that evidence but are not yet diabetic. Because this process occurs over a long time, you may not have any symptoms at all or only minor ones. You may have been found to be diabetic after a random blood test in a health check, or when you have a different illness like an infection, heart attack, which are complications of diabetes. If you do experience symptoms, they could include blurred vision, excessive thirst, excessive urination, or weight loss. These high blood glucose levels can also cause long-term complications, such as stroke, heart attack, nerve damage, peripheral vascular disease, kidney damage, CKD, chronic kidney disease, visual disturbances, cataracts, glaucoma, retinopathy. However, complications are not inevitable and can be prevented by controlling blood glucose levels. Doctors recommend lifestyle changes to remove excessive weight around your waist. Follow a low-fat, high-fiber diet with fruits, vegetables, whole grains, and limit sugary drinks and alcohol, but still enjoy foods you like. Doing exercise, even brisk walking, can improve your body's sensitivity to insulin. Most diabetics will start taking metformin tablets, which increase sensitivity to insulin and lower blood glucose levels. You could be started on several other different types of medications depending on glucose levels. Medication will help prevent unwanted symptoms. If you don't take medication, symptoms return and increase the risk of complications. The good news: you can get remission if you control sugar levels well and may then stop needing medications. High blood pressure occurs in 50% of diabetics and worsens complications. It is important to regularly check and treat high blood pressure. You will also need to start tablets to reduce cholesterol, as it increases risk of heart attack and strokes.